From the RSNA, I'm Dr. Jana Ivanice, and this is Radiology Imaging Cancer. We are back in your feed with a podcast episode focused on an article recently published in Radiology Imaging Cancer. Today's interview was conducted by our wonderful trainee editorial board member, Dr. Shah Islam. Shah is a neuroradiologist and is currently a clinical research fellow in the Division of Brain Sciences at Imperial College London. Our listeners may recognize Shah from his recent thoughtful interview with Dr. Edward Lin discussing Dr. Lin's work on multimodal imaging of paragangliomas. And if you haven't had a chance to listen to it yet, I highly recommend it. Today, we bring to you a very optimistic and stimulating discussion between Dr. Shah Islam and Drs. Yantian Zhang and Robert Nordstrom, who both serve in leadership roles at the National Cancer Institute. Drs. Zhang and Nordstrom have jointly authored a very insightful and uplifting editorial in the current issue of Radiology Imaging Cancer, which is titled Celebrating Contributions of Imaging Technology to Fight Against Cancer at the 50th National Cancer Act Anniversary. As someone who focuses on oncologic and neuro-oncologic imaging, I really enjoyed the article as well as the interview. I hope you enjoyed this podcast episode, and as always, we look forward to your feedback. You can find a link to the featured article in our show notes. Enjoy the interview. Be in Chicago for RSNA 2022, Empowering Patients and Partners in Care, where the biggest week in radiology inspires professionals and industry partners from around the world. Be engaged with more than 400 educational courses and scientific sessions from every subspecialty. Be inspired by more than 500 exhibitors featuring the latest technology, demos, and industry presentations. Join us in person, virtually, or both. Register now at rsna.org/register.
So it's my pleasure today to welcome Dr. Yantian Zhang, who's a biomedical engineer by background, having worked in a number of prestigious roles across imaging science, which includes, even as a MRI physicist, he's now chief of the Imaging Technology Development Program at the National Cancer Institute Cancer Imaging Program, and his co-author, Dr. Robert Nordstrom, who's Deputy Associate Director in the Cancer Imaging Program, National Cancer Institute, and Chief of Image Guided Intervention Branch. He also serves as the Director of the Quantitative Imaging Network, a major program within the National Cancer Institute. In this position, he's coordinated research efforts of approximately 20 academic institutions as a network of the application of quantitative imaging methods to measure the predicted response to cancer therapies in clinical trials. We've gathered here today because, as part of the Radiology Imaging Cancer podcast series, we'd really like to talk about a recent editorial which was titled Celebrating Contributions of Imaging Technology to Fight Cancer at the 50th NCA anniversary. So we have a wide reader base and listener base. And for those of you who don't know, the NCA stands for the National Cancer Act, and it was signed in 1971 by President Richard Nixon. It really catalyzed the breakthroughs in cancer research and care and has improved the lives of millions of cancer sufferers since. So Dr. Zhang, Dr. Nordstrom, thank you so much for joining me today. For our listeners who aren't from the United States, could you give us a little bit of a background to the National Cancer Act and a little bit about its legacy and what we've seen over the last 50 years in terms of medical imaging? Dr. Nordstrom, would you like to start?
Well, as you said, the National Cancer Act was a result of President Nixon back in the 70s. It's interesting because the National Cancer Institutes of Health was also at the same time was going on, but National Cancer Institute was separate from that. It actually is a part of the National Institutes of Health now, but has a director that is separately appointed by the President of the United States. So we remain somewhat autonomous from a lot of the things that go on at the National Institutes of Health. We've been moving along for a good deal of time with what we're doing in imaging.
So the National Cancer Act was a piece of legislation that almost guaranteed sustained funding support for cancer research. And over the last 50 years, really as you said, it changed lives and really made cancer research much better. So it's really an important occasion for us all to really celebrate that occasion. And I think from our perspective on the imaging science side, we would like to recognize that imaging technology development in this last 50 years made a major contribution to our overall fight against cancer. And it is a fantastic time if we go back, and it's a fun topic that Bob and I used to talk about. And we think it is something that's not only scientifically interesting, improved our understanding of the disease, way of detecting, managing, cancer, but it's by itself, it's an amazing time that you look at the imaging modalities that come along in this last 50 years. It's nothing short of, a miracle, I would say. So that's more of, the purpose for why we wanted to do something like this. Not only it's interesting, but it's also fun.
I think from when I read the editorial, sometimes we get so focused on our own research programs and where we want to take things, we don't actually take a step back to reflect on what we have as a group, what everyone has contributed to the field. And it's quite inspiring to think in 50 years how much we've achieved, and then what going forward, the future looks very promising. Going back to the last 50 years, you both come from slightly different backgrounds. Start with you, Dr. Zhang. What do you think has been your personal highlight in terms of the imaging technologies that have come through?
Well, we nowadays count all those major imaging modalities that you see commonly in the hospital, and we tend to forget that 50 years ago they don't exist. So all those are really, I would say, highlights in our career. I mean, our working career. And what we try to do is to actually not only reflect on this history, the brief history, but try to actually annotate, this rich history with interesting tidbits of funding by NCI of some of the early pioneers development work in these fields, in all those burgeoning new imaging modalities. Now, you go into any modern hospital, the first thing you probably, as a patient, would encounter is, getting an image of some type, MR, CT. So they are, to me, they are all highlights. Of course, my background is more early days in MR technology development. So there are a lot of interesting stories and interesting facts to reflect upon. I'm sure Bob has a lot of other stories too.
Well, my background recently is now with quantitative imaging. The idea that images carry knowledge, and if we can extract that knowledge from the images in some way, that we will gain information about the progress of the disease and hopefully the progress of the efforts that are going on to cure the disease. So imaging is a platform for releasing this kind of information, if in fact we can collect it correctly. And the idea of quantitative imaging is something that has been on my forefront for the last almost 12 years. And it encompasses all of the imaging modalities, as Yantian was talking about. So we have to be very versatile in what we think of and how we go about putting quantitative aspects into the imaging. It's not only the recording of the images and the analysis of the images, but it's all the aspects of extracting the right information from the images that will enable the clinician to make proper deduction of what's going on.
As a frontline radiologist, one of the biggest advances that was tangible was the introduction of a PACS archive. So we've been, as a field, creating large data sets that exist in a digital format, which opened the field up to bioinformatics, and now you can't really mention radiology without mentioning AI or computational techniques and whatnot. What are your views on the development of AI technologies? Because whilst in the last 5 years there was a lot of hype, there's been very little that's actually translated into frontline clinical practice. Do you have any views about that, Dr. Zhang?
So, well, as you said, I mean, imaging informatics, for example, research is always, goes always hand in hand with imaging technology development, and we use this informatics research to help us understand, interpret image results, to develop biomarkers for disease, for detection, diagnosis, all process of patient management, monitoring and evaluating treatment response. And as Bob mentioned, the quantitative imaging network, I mean, we use informatics technology or tools to really derive a more quantitative understanding of disease progress, of changes in conditions due to therapy, etc. So we do quite a bit. I mean, I think you're right, a lot more is to come. I mean, with AI, with all this, starting, for example, from iterative image reconstruction. So all this technology not only applied in the understanding or the interpretation of results, but also in the acquisition of images, iterative reconstruction, AI-assisted reconstruction, etc. So a lot more are coming. But yeah, I guess the bottleneck right now is really how do we actually push some of those advances into clinical practice and to actually impact patient care.
I think you hit the nail on the head. I mean, whilst a lot of the hype is driven from the potential of AI into frontline clinical practice of clinical decision support and whatnot, but there's so much which is going on with AI technologies before the images actually get to the radiologists, as you say, image reconstruction. And what I think the actual bigger play is making imaging more accessible, cheaper, faster, a better patient experience. And that may be the bigger lasting legacy in the immediate short term. But obviously, there's still a lot of work to be done to take some of these technologies into the front line. I think if we were to write this review in another 50 years, there would be a whole massive section on that computational drive and AI technologies. But I still think what you've written today and looking back 50 years with the aid of the National Cancer Act is nothing short of remarkable. And there's still so much to be done. When you wrote the editorial, because we have a lot of younger writers and a listener base, they always listen to the podcast and they're always looking for like top tips on how to write editorials, reviews. You've both got really strong academic careers. Do you have any tips for them on how to really get that manuscript into shape and get it over that finishing line to see it into print?
Well, we were lucky because as members of the National Cancer Institute, we have an overview of a number of different projects. Our portfolio is rich with work that's being done in every area of clinical imaging. So we have a strong pool of background information to call on, and that made the editorial an ideal format for us, particularly to deal with. The researchers, of course, their task is to dig deep into what's going on with their particular problem, and they don't often see the larger picture that we are fortunate to be able to cover. So it's difficult for me to provide information to those that are in the trenches when we're sitting a little bit higher up and looking at the picture from the 30,000 foot level. Maybe Yantian has something to add to it.
Well, that's a great summary. I think from my perspective, if we can be of help to people wanting to write an editorial, first thing is to come up with a contemporary topic that is important, but also of interest to the journal readership, and present a broad view, as Bob pointed out, and hopefully to help inform and energize the journal readership. I mean, in this case, is to make us feel proud that we in the imaging community have made this tremendous progress, really helped our fight against cancer, and they celebrate the achievements of those people who led this nothing short of revolution, I would say. I mean, you look at the Nobel Prize recognitions, and maybe forthcoming even more to the field, I mean, to a number of those different modalities. In the next 50 years, as you pointed out, informatics research and big data science, our ability to actually look at much broader swath of data in a more integrated way, and for us looking at imaging as some kind of a bridge across those physical and temporal scale to actually and use maybe informatics tools to actually integrate different areas of research that are right now going on by themselves. For example, understanding molecular cellular interactions on one end to understand the patient management or improve patient management. And so imaging, I think, plays a bridging role, and that's what we hope by writing something like this, we can look back, but also give us a perspective to look forward and be excited about what's coming in the next 50 years. So that's how I would put it.
I completely agree. I don't think when this legislation was passed, anyone could predict just how big a part of cancer diagnostics and treatments, how big a part imaging would play in it. It really is now central to a lot of, well, much of cancer care. And I think that's only going to grow. The imaging becomes cheaper, more accessible, more precise. This drive towards precision medicine. And I do a lot of PET imaging, and the tracers that we're building that are tumor specific, that can are biomarkers for treatment response. It's just absolutely incredible, and that's just one part of imaging. If you scale that, other modalities, CT is becoming lower dose, again, cheaper, more accessible. In the editorial, we've gone through the advances in ultrasound and microbubbles. It really is fascinating, and it's a great place to be if you're an imaging researcher. I think it's just going to go strength. Going back to the editorial, I think it really is a celebration of not just what we've achieved as a community, but also the legacy of this particular program. If anything, we need to continually be innovative in our ways to be able to fund the best ideas, and we really want to see more and more programs that can help imaging go forward. On that note, is there anything you'd like to add?
It's important to remember that imaging modalities sort of fall into two basic camps in the way I think about it. There are those that are clinically used in a regular way, and we talk about MR, CTs, PETs, that sort of thing. But there's a whole set of imaging modalities that are on the peripheral now that are coming forward. OCT is now becoming a very popular kind of technology, and there's a number of other optical, ultrasound, and other technologies that are gaining ground outside of common clinical use, but I think will become more so in the near future. And I'm really excited to see how these technologies can break in and complement with the technologies that are already in use. And as I said earlier, some of these technologies are very expensive, so some of these new technologies may cut the way for cheaper, more efficient ways of looking into the body and seeing what's really going on.
I think all this, as Bob mentioned, the optical imaging, et cetera, are certainly, very, very exciting. And one of the topic theme that we keep on thinking about with the advance of genetics and genomics, understanding of disease at the molecular cellular level, there's this great, tremendous need to integrate from the microscopic or molecular scale to the macroscopic and over the time span. So I think imaging definitely will play a strong role. And maybe on the microscopic side, a lot of this new optical imaging and being able to actually see cell morphology, for example, can be connected to, say, for example, cell typing by genetic or genomic signatures. It's exciting to think about those possibilities and to actually see where imaging can play a major role, as I mentioned, as a bridging role to help bring together our understanding of the disease from the molecular microscopic level to the macroscopic tissue level, including the tumor microenvironment and genome mutation basis understanding of the mutation of the disease, etc., and the functional impact. So those are the things that I think all imaging or future imaging will address, as I would regard them as emerging needs and opportunities, not only research, but also eventually helping to improve patient outcome. So hopefully, next 50 years, we can look back and, and look at this point and be excited and think that, so much more is going to happen hopefully in the next 50 years, so much more is going to happen. But it's amazing. Yeah, it's an amazing time though. We couldn't really be more excited about this last 50 years.
So whilst today we celebrate the last 50 years, I think we're all in agreement the future is bright. And everything that we do today in our current practices, our current research, is always a stepping stone for someone else to take that technology, that research, and grow it, which is really important. So on that closing note, I'd just like to thank you both for taking your time, firstly for the editorial, which is absolutely brilliant, and our readers will absolutely love it, and for recording this podcast with me today. Thank you. I know you're both very busy, and I'd just like to congratulate you both on everything that you have achieved today, and really laying some foundations for another generation of researchers to build on whatever you're doing at the moment, and we will be celebrating those in 50 years, no doubt.
Thank you, Dr. Islam.
Thank you. It's been a pleasure.
Yeah, thanks for taking time.
Thank you, guys.
This concludes today's episode. Many thanks to Dr. Yantian Zhang and Dr. Robert Nordstrom from National Cancer Institute, and of course to Dr. Shah Islam of the Radiology Imaging Cancer Trainee Editorial Board for this inspiring interview. It certainly makes me look forward to what's on the horizon for the next 50 years of cancer imaging research and clinical translation. Thank you all for listening, and we look forward to your feedback via email or met Twitter. I'm Dr. Yana Ivanidze, and this is Radiology Imaging Cancer. Thank you.